Lateral epicondylalgia is formerly known as lateral humeral epicondylitis, or more commonly known as tennis elbow. It most typically involves the extensor carpi radialis brevis muscle. This muscle inserts into the base of the third metacarpal and is centrally positioned to function in wrist extension. The extensor digitorum communis has also been implicated. Algia means pain. This is reinforcing a complex condition with potentially several pathophysiology mechanisms. So initially, you have an inflammatory condition over time. However, you end up with a tendinosis that's a degenerative, non-inflammatory paradigm of the extensor carpi radialis brevis causing your problems. Lateral epicondylalgia will occur due to several different mechanisms. There may be an eccentric loading of extensor muscles. This usually occurs in novice and beginning tennis players. There can also be an eccentric tension or a forced flexion. This occurs most oftenly with the backhand stroke when you have an eccentric ball contact. During this time, you will note weakness and a change in neuromuscular control. Finally, biomechanics may contribute due to a faulty tennis stroke. A final mechanism of injury is going to occur in people who are older, maybe in the 30 to 50-year-old range. This is caused by the equipment, specifically the tennis racket. You may find that the racket head size is too large. The racket stiffness is too much because of overstrung strings. There may be a problem with the grip force or the grip size. When you have a grip size that's too small, you find an increased grip and increased muscle activity. And conversely, when it's too large, it's a decreased grip and decreased muscle activity. Signs and symptoms are going to include edema at the lateral epicondyle, although that is not usually visible. The pain will be localized to the lateral epicondyle or just distal, with or without forced wrist flexion. It may also radiate into the forearm extension during and after activity. Pain will occur during the backhand stroke, and you may also find signs and symptoms occupationally in electricians and politicians. Electricians because of using etheric tools such as screwdrivers, and politicians from shaking hands. There will be decreased wrist flexion with or without elbow extension. You can perform a special test such as the tennis elbow test. As well as the coffee cup test. And coffee cup test is simply lifting a coffee cup, which we did not have in this video here. The manual muscle test that you will want to perform is for the extensor carpi radialis brevis. Diagnosis is clinical. Treatment is generally going to start out as conservative. We will use counterforce bracing. We will have the athlete eccentrically train the wrist extensors, make sure that there is proper stroke biomechanics, check for proper equipment, and encourage a warm-up and cool down when participating in the sport. If surgical intervention is required, this will consist of an epicondylar resection with an anconeus transfer, and or there may be a distal lengthening of the extensor carpi radialis brevis.